We now have with us in the studio Dr. Atika Fitri, who is a general practitioner from MMC Hospital. Good morning, Doc. Thank you for joining us today.
Hi, thank you for having me.
So, can you just give us an overview? What exactly is a premarital screening? Because I know for a fact before we got married, that we didn't even think of doing anything such as a health screening or a premarital screening.
Yeah, okay. First thing first, premarital screening is a set of examinations that you have to do before you have a marriage. Yeah, in several countries, it is a mandatory requirement for you to register your marriage.
Oh,
yeah, and in Indonesia, there are some of requirement that you should submit the what is kind of health certificate that you should
health report.
done, yeah, to report it to the regional affairs before you have a marriage.
Okay.
Like that.
Now, this might be not very familiar with Indonesians because then people would think, oh, what if then I found out that I have an issue or a problem and my husband also have one and we cannot get married because of that, right? So when do you recommend people actually to get tested for premarital screening?
Yeah, basically, Indonesian Ministry of Health has recommended us to do the premarital screening at least 6 months prior to marriage.
Okay.
Yeah, but we suggest you to do it like 3 until 6 months before marriage. Then we have still enough time to have, if you have any medical problems, that we can fix it. Yeah, and yeah, if you have any problems or any preventable things that we can do before the marriage happens.
Okay, one thing that I have learned recently as well, again, I didn't know any of this before I got married or had kids, was a blood type test as well, because apparently blood types have to be compatible in order for you to have healthy offspring. But that also means that, you know, if you're not compatible, there's not much you can do about it. And apart from these blood type compatibility tests, what other things would we be testing for before you get married?
Okay, for premarital screening, there are so many things that we can do. The first one, you get to see a doctor.
Okay.
Yeah, we should do a thorough history taking and physical examination. We will ask you about your recent medical history and then your past medical history, your family history. Is there any cardiovascular diseases, any diabetes, or any genetic diseases that inherited from your family?
So this is more towards general health then?
Yeah. It's just like a medical checkups, routine medical checkups, but it is like deeply for your family in the future. Yeah.
Right.
Then the next one, there will be a physical examination. We will check your BMI, whether you will have any obesity or even underweight, because it will affect your fertility later. And also, we will do some head-to-toe examinations, whether if you have any medical conditions that we should be prevent later. And the next one is the laboratory examinations. We will do the complete blood count, whether if you have anemia, a low hemoglobin, then it will be affecting your health and when you are in the pregnancy later, especially for female.
Okay. So
And the
these
next
are
one-
through blood tests then?
Yeah, we will do the blood test. The second one will be the blood type testing.
Okay.
The blood type testing, there will be two kind of blood type, the ABO type, and also the rhesus type. Yeah, there's some of the things like incompatibility conditions, whether if you have incompatibility rhesus from the female or and the male, especially when you marry a Caucasian, different race, different race spouse soon to be, but. Yeah, if you have any kind of this incompatibility things, then you will have the first baby will be okay, but the second one, the mother will produce an antibody, then it will make there will be have a miscarriage or stillbirth, and it won't be good for your offspring.
Right.
later.
And in fact, I've heard of, and I've only known this because I've actually spoken with somebody who has had to live through this. It was a couple that got married. They didn't know they had incompatible blood types, and they only found out when they lost one of their children. I can't remember if it was the first or second, but most likely the second, right?
Yeah.
And this is something that is so difficult to tackle because if you have a pre-existing health condition, for example, a high cholesterol or things like that, these are something you can kind of reverse. Perhaps you can change your lifestyle, or you can do something about it as you get married or as you plan your family. But something like an incompatible rhesus blood type, that is something that's difficult to handle. What do people usually do when they find out they have nothing, something that is incompatible in regards to blood type?
Yeah, if we have known that there is an incompatibility, then you should see a specialist, because it is a condition that can be handled, if you have any incompatibility, then if you plan to have a baby, the first baby will be okay, but the next babies, if you have more than one children, then the mother should have some therapy, such as the mother should be given like immunoglobulin to depress the antibody from the mother to the baby.
Oh, okay. So there's something can be done as long as you know about it.
So that's why you should do it
all
before.
and be all, and you cannot get married.
Okay.
And so in case, for example, if a couple missed the pre-screening marital test, for example, because of lack of information, is it still okay then to do it after you get married and to be treated after you get married?
Yeah, basically it can be done after married, but it's better to know it way before you have married, right? Especially if you have any transmissible diseases, such as just like sexually transmitted diseases. Then if you maybe if there is a couple that didn't really talk about it deeply, then the test will be objective enough to see if there is any kind of things like just like HIV, just like hepatitis, and also so many transmissible diseases that cannot be talked to.
So it's not only about compatibility for the offspring, but also just a simple of each other, exactly.
So I cannot imagine a lot of people get this done, because me myself, I didn't know, but nobody was there to tell us either. I mean, it wasn't like I spoke to a doctor who advised, hey, you guys should do a premarital screening test before you guys get married. How can we encourage people to do this more? Because it's not general information that's out there when people get married. A lot of things that I listed, it's already on the top of our minds, like, oh, where do you want to get married? Who are we going to invite? Where are you going to get your wedding dress from? But nobody ever brings out medical tests. So how can we encourage more people to do these screening tests before they get married?
Yeah, the first one is you have to if you decided to get married, then you decided to make a family. Then you also have a responsibility for your offsprings later. Then it is very important for us to have a healthy and a good quality for your offsprings, especially the quality of your health. So that's the message that I will bring, because this is a very important thing besides your preparation for your big day, right? It's only just happen in one day, but your health it's happened your long life, and you will have your family like forever.
I guess that's the best way, right? I mean, we have to encourage those that are close to us if they plan to get married, and just like kind of bring it up. Hey, did you guys do a premarital test? Because even family planning, I'll be honest, I didn't really plan family while we were getting married. We didn't even talk about, oh, are we going to have kids? When are we going to have kids? I know some people do, but most people are just concerned about the step that's right ahead of them. They're not thinking 3-4 steps ahead. And I think we need to encourage like loved ones, perhaps if we have siblings or friends that are getting married, don't be shy to bring that up, because otherwise they may not know about it. It's something that I would have appreciated knowing, and luckily we have not had any health problems per se. But what if we did, right? Nobody was there to tell us.
Yeah, I think also like generations is changing, right? And I think the upcoming marriage couples are the millennials and Gen Z. So how are doctors collaborating more to put this information out there more for millennials and Gen Z? Is there any certain like campaign or information sharing?
Yeah, we also do like a campaign. Yeah, we also in our hospital we did some packages for soon to be married couple to have any medical checkups for premarital screening. There are some of the packages, and also the whole examinations are available there. And if, we also did the campaign in the social media. If you have any questions, then maybe you can ask the doctors. And also And maybe in last decades, also the millennial soon-to-be married couple, they really like the awareness of this is like higher than
more.
than the
It's
last one.
increasing.
Yeah.
So I would like to ask, because this is probably a sensitive question, but I think it would be beneficial also for our audience. What would be the range of price for a premarital screening? Because this is also probably one of the key factors whether someone will do it or not.
And it's quite extensive. It's
Exactly.
a lot of tests.
Yeah, a lot of tests, especially for the genetic testing.
Yeah.
It is like a very wide range.
Okay.
Yeah, from the basic test until the most advanced. Like, yeah, it is starting from like around maybe 2 millions rupiah
Okay.
until like more than 5 million.
Yeah, it depends on how much you want to test, right? How many different tests.
But if you have insurance or universal coverage,
Yep.
maybe, you can do that.
Okay.
Oh, that's
nice.
I want to ask you, Doc, in your experience, I'm sure you've done marital tests before. How much of a difference has it made to these potentially married couples and potential families that they're about to start? For example, if they found anything that is, incompatible or inconsistent, and have they made changes and has it worked in order for them to have a better life together?
There are some patients that have just known about their conditions before they get married, but after that we refer them to the specialist, then they have overcome their problem. Then they are now in a happy family,
In a good
in a
Healthy
good
kids.
condition. Yeah.
So it does make a difference.
Yeah, so I guess information and truth is the key, right? It's not something to be feared
Right.
on, but it's something, there's always some remedy or some
Yeah.
healing that we can do together with the practitioner.
And by the way, you're going to figure this out soon, Rasha, because some people spend, hundreds of million of rupiah on a
Yeah.
wedding. A couple more is not going to hurt, especially if it's going to be something so beneficial as
Yeah,
this. So it's
yeah,
something that you should definitely plan as part of your budget as
So
for your wedding as
fundamental.
well.
Yes.
Exactly.